Hi everyone, and welcome back to the Millcreek Government Channel. I'm Jessica Stutzman. First-time expecting mothers and fathers are deeply aware of two notions. There are some big changes ahead, and there's going to be a lot to learn in the next 9 months. During this show, we are going to prepare families by giving support, advice, and information that will help you prepare you during your pregnancy and the years that follow with your newborn baby. Joining me today from the Erie County Health Department is Charlotte Beringer. Charlotte is the Director of Community Health Services with a BSN and RN background in nursing. Charlotte, thanks so much for joining me on the show today.
Well, thank you for inviting me. My pleasure to be here.
Oh, thank you. This is a very exciting, I think, topic to talk about. Everybody is, very nervous when they first get pregnant. There's a lot of information out there, and I just want to share with some of our viewers, and whether, again, you're a first-time mom or a second-time mom or, so on and so forth, there's always new information to learn.
There certainly is, and there is a wealth of information that most of us have not been exposed to before we've had our first pregnancy.
And we're going to tap into that. We're going to tap into your brain and into your programs here during the show. So the first thing I wanted to touch on is, why is prenatal pregnancy health so important to the Erie County Health Department?
Well, we're really interested in the health department and the health of populations. So we want as many women as possible in Erie County to have healthy pregnancies, to have healthy children, to raise healthy families. It's just the mission of what the health department is.
And what are some of those do's and no-nos, do's and don'ts and no-nos that we should follow during the pregnancies?
Well, we have to remember as women, anything that we consume, whether we eat it, whether we smoke it, whether we inhale it, is going to affect the baby in some way. Even though the child's not born, the baby's growing in us. So when we look at things like tobacco exposure, nicotine exposure, drug exposure, it might be prescription drugs, it might be not prescription drugs, it might be street drugs of some sort. All of those have some impact on a fetus, and many times not a positive one.
And I was going to say that was definitely the first thing, when my husband and I, when we became pregnant, the first things we heard, of course, no alcohol, even be careful of prescription drugs, no smoking, even avoid, cleaning the litter box, avoid, toxic cleaning chemicals. There were so many things that we were being inundated with. As far as information goes.
Right, and that really does hold true, especially the no alcohol. Fetal alcohol syndrome oftentimes is not recognized initially right at birth. Oftentimes the symptoms aren't really seen until a child is in an educational setting. And any amount of alcohol in pregnancy is really not recommended. The kitty box is a classic public health one. There's a certain disease that you can get if you change litter boxes and might get exposed to it.
Right.
So I know when I was pregnant, my husband changed the litter box the entire pregnancy.
All 9 months, yep. That becomes their job, and then we'll take it back over once the baby comes.
Exactly.
And then you mentioned smoking. So smoking is obviously, we've had the health department on before for smoking cessation programs and tips and classes, but smoking is harmful for anybody, but especially for mommy and the growing baby. So why is that so harmful? What are some of those bad side effects the baby might see?
Okay, well, we know with women who smoke during pregnancy that statistically more of their children are of low birth weight or lower birth weight than would be desired. We know that there's a connection between sudden infant death syndrome that can occur sometime between usually like a month old and 6 months old. Sudden unexplained death is what SIDS stands for, but we know that statistically it's very much connected back to women who smoke during pregnancy. Figure that when a woman has smoke or nicotine in her system, it's having an effect that is not a positive effect, and that in turn will affect the baby in a negative way also.
And so, and I at first was referring just to firsthand smoke, the mother doing the smoking, but are there any harmful side effects from, secondhand smoke, or from, we've even talked about thirdhand smoke on the show. Are there any harmful side effects from that?
That's not as well documented as the direct use of a tobacco product by the mom itself.
Okay.
Secondhand smoke in particular has a stronger theoretical connection for a risk for pregnancy. Third-hand smoke, there's just not the research out there yet.
Okay. And so when we refer to smoking, what types of tobacco use does this actually refer to?
Okay, and that gets really interesting. The products these days, oftentimes we just think of the classic cigarettes.
Right.
Because it's the tobacco, it's the nicotine. Well, it's really the nicotine that we're concerned about during pregnancy. So some women will say, well, I'm pregnant, I'll switch to e-cigarettes. That's safe.
Right.
E-cigarettes still have nicotine.
Right.
So that's included. There's cigars, there's hookah. Hookah is really popular, and hookah is typically nicotine-based. There's actually what's called dissolvable tobacco. Again, that gives a woman the nicotine. Some women will use pipes. Any of those are potential exposures to tobacco and or nicotine. And those are exposures that do not contribute to a healthy pregnancy.
And some of the other things that you've listed were, again, chewing tobacco, dissolvable tobacco, and the clove cigarettes.
Right, and those are seen not as often, but they are definitely still risk products for the nicotine exposure.
Okay, and so the other thing I'm thinking of is, if a mom is trying to quit, they make those patches, but those patches also have nicotine in them as well. Is that right?
Okay, and there's actually medical research on that. So if a woman wants to quit during pregnancy, the patches aren't necessarily always recommended, but sometimes they would be better use than the amount of the other product that was being used. So that would be a decision between a woman and her medical provider, because those they should be medically prescribed during pregnancy.
Okay, so she should definitely, a pregnant woman finding out she's expecting should definitely talk to her doctor and be upfront and say, I am a smoker, what should I do?
Correct, because there are good options for her.
And what programs does the county offer as far as making this an incentive to stop smoking?
Okay, I am very glad you asked that question. Very recently, we, along with 4 community partners, have begun to offer a tobacco cessation service, so helping pregnant women quit smoking during pregnancy and stay quit for that year afterwards, so that it's a healthier environment for that babe for that whole first year of life. It's called Baby and Me Tobacco Free. It's actually an evidence-based program. It's gone through good research reviewed, has been reviewed by the Centers for Disease Control and accepted as a promising practice. With this service, it's open to any woman who has used any of the tobacco products that we talked about. Either she's using them during pregnancy, or if she even used them in the 6 months prior to pregnancy.
Oh, okay.
She is eligible to enroll in this service, this Baby and Me Tobacco Free. And what it provides is, during pregnancy, 4 tobacco cessation sessions with a certified tobacco cessation counselor.
Because this takes time. I mean, quitting is very hard.
Quitting is hard. Nicotine is a physical addiction along with a psychological addiction. So it does take time. But again, there's good known techniques. We're going to give some little gifts to help keep the hands busy or the mouth busy to, help avoid the use of the cigarettes or whatever. If a woman succeeds in stopping smoking while she's still pregnant, she's eligible for a $25 diaper voucher from Walmart.
Wonderful. Oh, that's great.
Okay, and if she has stopped early enough, she could actually earn 2 of those vouchers during pregnancy. Okay, so she's gotten through pregnancy. Maybe she didn't quite quit by the time she delivered, but she can quit shortly afterwards. Again, she can come back in every month, meet with the tobacco cessation counselor. We test the women with a carbon monoxide monitor, so we know whether they're still exposed to nicotine or not. And if she's clear, another $25 diaper voucher.
That's so helpful.
So there's the potential for 14 $25 diaper vouchers.
14 of those?
14 of those.
That's a lot of money
after
saved.
they deliver, and 2 months potentially before if a woman actually succeeds.
Wow.
And again, take them to any Walmart. And they're actually now usable for diapers and wipes, both.
Oh, okay.
So, because we know to get, if women want to go back to work, and if they're using a licensed child care center, they have to be able to send in disposable diapers.
Yeah.
Because licensed child care centers will generally not take them without that.
Right.
The beauty of this program is there is no income guidelines. Open to any woman who is smoking or using tobacco products during pregnancy or has used them 6 months prior to pregnancy.
Okay, and how do they get in touch with you or get in touch with your office to start this program?
Okay, they can call into us at the health department. 451-6700 is actually our switchboard. Somebody there can take a referral. They can call 451-6711, get to our intake nurse. A referral can be taken there.
Okay.
And I mentioned we're community partners. Maybe the health department site or ours is not a good fit for them. They can go to JCAC, the Head Start program is using it. The Erie Family Center is using it. The Women's Care Center is using it. And I'm not remembering the fourth one right now, and that's very bad.
It's okay, we'll put it on the screen. We'll put it on the screen.
So again, there's options for other places to go to actually receive that service.
So it's convenient, and it's going to save them a lot of money in diapers.
Correct. Right. And it will have, the whole goal of the program is to have a healthier pregnancy and a healthier outcome for the babe. And that's really what we're looking for.
And what success stories have you seen from this program?
Locally, we're really just getting started with it, so we haven't had our first person go totally through the program. But we know from the national statistics for the program and the number of states that it's in, it's 70% of the women have succeeded in quitting smoking.
Okay.
At least through 6 months after having the babe.
Oh, wonderful.
So that is significant.
Yes.
As hard as that habit is to break, that's very significant.
Yeah. And does this program just apply to mommy, or does it apply to anybody else in the household?
In Erie County, it's only applying to the mom right now, and that's a funding issue. Down the road, if we could raise additional monies, we could potentially offer it to the partner or to someone else, another adult who's in the household and a smoker. But currently in Erie County, it is just for the pregnant woman.
Okay, and so for your website, for if people want to check out more information, www.ecdh.org, and then www.babyandmetobacco-free.org.
Correct, and the babyandmetobacco-free.org is the national website, but there's a locator on there that would direct them towards Erie County resources also.
That's fantastic. And then another program you offer through the Erie County Health Department, and again geared specifically towards pregnant women, is your Nurse Family Partnership Program. What does this entail? Okay,
Nurse Family Partnership is another evidence-based program, again nationally. We were one of the first sites up in Erie County. We've been offering this service since early 2000 in Erie County. It's geared towards first-time pregnant women. They do need to meet income guidelines, but if a woman even qualifies for WIC, for the Women, Infants, and Children program, she qualifies to enroll in Nurse Family Partnership. It's one-on-one with a nurse. We want to enroll a woman before the second trimester of pregnancy, so before she hits her 6 months of pregnancy, we want to have her enrolled. And we will stay with her all the way through delivery and the baby being 2 years of age. So potentially 2.5 years, a nurse can stay one-on-one with a family.
That's like, must feel, really put them at ease, to have that one-on-one interaction with a nurse.
Right. Really have an opportunity to build a relationship, get to trust each other. And we're not just coming in, we're not coming in from the medical model, you have to do this.
Right.
That is not at our approach. Our approach is with any woman who enrolls us, what's your heart's desire? What is it that you really want to happen with you and this baby, or whatever relationship that you're in? We work from the strengths of the woman, and we build on those. So yeah, we're going to be looking at medical things. Are they eating well? Do they understand nutrition? How much weight gain they should have? What meds they should or should not be using? Discouraging the use of illicit materials. But we're also going to be looking at things like, what's their family and friend situation like? What kind of support systems do they have? We're going to be looking at what's your education and job training or your work environment like? Do you have goals that you want to reach there? So it's really looking at the woman as a whole.
Right.
It actually started out as a juvenile delinquency prevention project, because we know that kids at 15 years of age who had this service when they were babes has less juvenile delinquency.
Oh, really?
Absolutely.
So like you said, it is all evidence-based.
It is all evidence-based. So certainly that's not the emphasis for the program today. The emphasis is more on the healthy families as a whole. But we have 4 nurses that service this program. We can provide services to a total of 100 women at any one period of time.
That's a lot of women, in fact, affected by, in Erie County that could really benefit from this program.
Most certainly.
So how often does the nurse come into the home?
It depends what phase of the program they're in. So when we first enroll them, it's going to be about every 2 weeks.
Okay.
It might cut back to once a month until they deliver, but probably not. Actually, no, wait, let's redo that part. When they first get enrolled, it's actually going to be once a week.
Okay.
And then, depending how long they've enrolled, might be cut back to once every 2 weeks until they deliver. Once they deliver, it'll be once a week again, probably for 6 or 8 weeks. We'll even out to once every 2 weeks. We'll keep that until the baby is about 22 months old. Then it'll cut down once a month, and we'll discharge when the baby is 24 months old. Now, that's not hard and fast. Again, so many of our women are working and/or in school, so that schedule can be more flexible to meet their needs also.
Okay, and when when the nurse actually does come to the home, it's obviously at a convenient time, for the mommy and for the family. But what is the nurse doing when she gets there? Okay.
It's a lot of conversation. It's a lot of understanding what's important to the mom. What is it that she wants to learn about? We have assessments that we can go through. So if something like, say there's a depression screening, and she scores high on that, we can talk about that. We can talk about referrals. Again, we don't do this alone. There's lots of other good human services, health and human services available to families. If it's appropriate, we'll hook them up with that information also.
And do the moms ever have questions, about, proper feeding or nutrition, or the nurse answers questions like that too, right?
Certainly once the baby is born, we're looking at all aspects of childcare. So yeah, if a mom is breastfeeding, we can give some pointers on that. She's really having concerns, we can make sure she gets connected with a lactation consultant. It's available through the hospitals or through the community. If she's bottle feeding, we'll make sure she understands, the preparation of the bottles. We'll talk about when to introduce solid foods. We'll talk about what's normal for sleep. We'll talk about normal growth and development. We'll talk about a baby's communication.
And what is that like?
Well, you know how we say with adults that 70 to 80% of our communication is nonverbal?
Right.
Well, a child is nonverbal, so 100% of their communication is nonverbal. But there really are cues that they give us, in whether they're making eye contact or not, whether they're turning their head, whether they're yawning, whether they're smiling, whether they're giggling. These are all communication methods. And so many adults think that, for that first year of life, all you really have to do is, feed them, change their diaper, and get them down for a nap. Oh, there is so much more that in ways that they really do interact with us if we just know what we're looking for.
Right. And, I'm sure, as a first-time mom, I'm sure some of this is intuitive, but I'm sure some of this is also very scary because it's all brand new.
It's all brand new. And especially the baby cues, that's not intuitive. That's not something that our parents really knew about to a great extent.
Really?
So this really is relatively new information that's being shared with moms at this point.
That's so interesting. And I said, I didn't even know about the baby cues. I don't really have younger children, that surround my family either. So I'm glad you brought that up because that's something that I'm going to bring back to my family. But I want to know who can enroll in this program.
Okay. Again, it is open to first-time pregnant women, and they do need to meet income guidelines.
Okay.
So again, they can call our intake line, 451-6700. They can actually call right to the secretary for the program, which I believe is 6733, 451-6733, and a referral will be taken. Sometimes it's a little bit of a waiting list, so the earlier in the pregnancy you call, the better, because we really need to get the women enrolled before the end of 6 months.
Okay, so how soon, if someone finds out she's pregnant, should she call and get on that waiting list right away?
The sooner the better.
Okay.
For sure. Generally speaking, we're probably not going to enroll them less than 3 months.
Okay.
But between 3 and 6 months, that's really where we really want to get the enrollments in.
Right, and then so how much does this cost? I know they have to meet income guidelines, but how much does it cost once the program starts?
There is no cost to the mom for
That's
this.
the best part.
That is absolutely the best part.
Absolutely free.
Absolutely free.
And so you mentioned the different ways to enroll in the program, and again, your website has more information. There's also their website, www.nursefamilypartnership.org. Again, all great resources to turn to. And I know you've got a little pamphlet on the table. Do you want to hold that one up?
Okay, for Nurse Family Partnership, this is what we're looking at.
So if you happen to be, again, down in your office, pick up one of these brochures, go online to their website. This all gives, great information on this particular program.
Very good.
And so then I want to move into a similar but different program that you offer, and it's called the Parent and Child Health Nurse Home Program, Visit Program.
Okay.
How is that one similar and different?
Okay. It's similar in that we'll see pregnant women. This is not the first time pregnant woman, though. This is the woman who it's her second, her third, her 10th. It's just not the first. Again, typically low income, but not necessarily. We're going to do the same type of teaching and assessments that are done in Nurse Family Partnership, but the visits would not be as frequent. Or last as long. So typically we'll enroll a mom either during pregnancy or shortly after she has delivered.
Okay.
And home visits will usually start at like once every 2 weeks, cut back to once a month. And usually if babe is developing okay, mom's getting comfortable in her role, by a year of age we'll usually be discharging that baby.
Okay.
Now if there's still ongoing concerns, we could keep them open for as long as another year. But typically we are discharging after about a year.
Okay.
Because again, the volume of women that are eligible for this service is much larger than the volume that's eligible for NFP. And I only have 2 nurses in this program,
Okay.
whereas I have 4 in Nurse Family Partnership.
So those nurses are spread a little bit more thin. And how long
Correct.
do those home visits last? The actual visit itself, is it an hour or less than?
Again, that depends on the needs of the family. I'd say that it's going to be a half-hour minimum most times, and probably an hour and a half max, and that would be unusual.
Okay.
I'd say probably an hour would be an average.
And what are those topics that are discussed during these particular visits?
Okay. Again, very similar to Nurse Family Partnership. During pregnancy, we're looking at a healthy pregnancy. What do you need to maintain a healthy pregnancy? We'll go over the signs and symptoms of labor and delivery so that they're prepared for that. Once they deliver, again, infant feeding, sleep, growth and development, reading baby's cues, all the same type of information, still looking at a mom's education and training aspects, and what are her social support systems also, making referrals where appropriate.
Right, right. And then I also read on your website just, weighing and measuring the baby and then watching the baby eat. It's sounds like it's, they're observing and like you said, reading the cues from the baby and looking for healthy growth.
Right, and that's all concrete feedback that we can give to a parent right then and there.
And how much do these visits cost?
These visits are also without charge.
Without charge.
Correct.
And so how do people get in contact with your department to again, start enrolling for these programs?
Okay. Best way is 451-6711, which is our nursing intake line. We do have an email, a general email, ecdhinfo@eriecounty.gov.org. But the easiest way is just to call in 451-6711.
Okay. And the very last thing I want to touch on, I thought this was so interesting. The last thing I want to touch on is the program that you have at the health department called Text for Baby.
Okay.
Do you want to we'll wrap up with this Text for Baby program.
Okay. Text for Baby is actually a national program set up by the Healthy Mothers, Healthy Babies coalitions across the country. And a woman can enroll, if they want to enroll for English, it's baby, B-A-B-Y, it's 511-411. If they want to enroll for Spanish, it's B-E-B-E, the same number, 511-411. And it's phenomenal. A pregnant woman gets 3 texts a week with information, and this is professional information. This is information that's pulled from medical sources, reputable sources. And just quick, a text is 800 characters or
Right.
less, but 3 times a week. And then once a mom delivers, the text can continue then for another year yet, so through that babe's first year of life. But
Wow.
just quick information, oftentimes links to get more information about the topic that they're speaking with. So it is a phenomenal service. And again, there's not a charge. And the beauty of that is it doesn't count against, like if you have limited text, it doesn't count against that. If you have limited minutes, it doesn't count against that.
Yeah.
Now there is a list of providers, but the 4 common carriers in Erie County are on that list of cell providers that are participating.
That's fantastic.
Yeah.
Well, I want to get my phone out. I don't have it on me, but I want to get my phone out. I want to text for babies, so again, I can find out more information. And like you said, it's coming right to your cell phone, so it's coming right to you, electronically, and it's very very good information to get easily. So,
Right.
Charlotte, thank you so much for being on our show today.
Okay, my pleasure.
Thank you. And viewers, if you have any questions about any of the programs Charlotte talked about, feel free to contact her office, her website. There's, again, great information, great pamphlets out there. And if you're a new mom, don't forget to text for baby so you get all that new information coming into you as well. Viewers, thanks for tuning into the Millcreek Government Channel. And until next time, have a great day.
You're watching the Millcreek Government Channel, powered by WQLN Public Media.